If you know what to look for, you can find warning signs of heart disease on your skin. Hi, I am Dr. I. Welcome to a healthy dose. Let's become healthier together. Sign number 1. Swelling in your feet and lower legs. What might this be telling you? Your heart is not working properly. Many diseases of the heart cause fluid to build up in your feet and lower legs. As the fluid builds up, you may see swelling, which can extend as far as the upper legs and groin. The medical name for this condition is edema, which is the medical term for swelling. Sign number 2. Blue or purple color on your skin. What might this be telling you? You have a blockage in a blood vessel. When you are extremely cold, your skin can turn blue. If an area of your skin is blue when you are warm, that's a sign your blood isn't getting enough oxygen. The patient in this photo has a condition known as blue toe syndrome, which happens when one or more blood vessels are blocked. Without treatment, the lack of oxygen can cause the skin and underlying tissue to eventually die. The medical name for this condition is cyanosis, which refers to the bluish color on the skin. Sign number 3. Blue or purple net-like pattern on your skin. What might this be telling you? You have a blocked artery. Some people see this pattern on their skin when they feel chilly. When their skin warms up, this pattern disappears. It's also possible to see this pattern when taking certain medications. If one of these is causing the net-like pattern, it's usually nothing to worry about. This net-like pattern can also be a sign of a disease called cholesterol embolization syndrome, which occurs when small arteries become blocked. The blockage can lead to damaged tissues and organs, so it's important to see a doctor to find out whether you have an undiagnosed disease. The medical name for this condition is Livedo reticularis, which is the medical term for the net-like pattern. Sign number 4. Yellowish-orange waxy growths on your skin. What might this be telling you? You have unhealthy cholesterol levels. If you see yellowish-orange growths on your skin, you may have deposits of cholesterol under your skin. These painless deposits can appear in many areas, including the corner of your eyes, lines on your palms, or the backs of your lower legs. If you notice these growths on any area of your skin, see your doctor. You may need cholesterol testing or another medical test. Unhealthy cholesterol levels require treatment, which can prevent life-threatening heart disease. Getting your cholesterol levels under control may also help clear the growths on your skin. The medical name for this condition is Xanthelasma, which are cholesterol deposits on the eyelids, and xanthoma, which are cholesterol deposits found elsewhere on the skin. Sign number 5. Clusters of waxy bumps that suddenly appear on your skin. So what might this be telling you? That you have skyrocketing cholesterol levels or diabetes. The sudden appearance of these bumps can look like a rash, warts, or a contagious skin condition called molluscum contagiosum. These bumps are actually fatty deposits of cholesterol caused by extremely high levels of triglycerides in the blood. Treatment is essential to lower the triglycerides and treat any serious medical conditions such as heart disease caused by the high cholesterol levels. The medical name for this condition is eruptive xanthoma. This refers to the sudden appearance of many fatty deposits of cholesterol. Sign number 6. Nails curve downward and the ends of your fingers are swollen. What might this be telling you? You may have a heart infection, heart disease, or lung problem. For many people, these signs are harmless. That said, if your fingers and nails look like this, it's best to find out if you have a medical condition such as lung disease or a heart problem. The medical name for this condition is called clubbing. Sign number 7. Red or purple lines under your nails. What might this be telling you? Most people who see these lines under their nails have injured the nail in some way. If you cannot remember injuring your nail, you may want to see your doctor. These lines can be a sign of heart disease or another condition. When it's a sign of heart disease, disease, people tend to have symptoms such as high fever and a weak or irregular heartbeat. The medical name for this condition is splinter hemorrhage. Sign number 8. Smooth, waxy lumps on your skin. What might this be telling you? You have protein deposits in your heart or another organ. These waxy lumps can appear anywhere on the skin. They often indicate that there is an abnormal buildup of protein in an organ, such as your heart. If protein builds up in the heart, it's hard for the heart to work properly. The medical name for this condition is Nodules of Systemic Amyloidosis. Sign number 9. Painful lumps in your fingers, toes, or both. What might this be telling you? You have an infection in your heart or blood vessels. If you have a heart infection known as infective endocarditis, these painful lumps can develop in your fingers, toes, or both places. The lumps can last for a few hours to several days. While the lumps go away on their own, patients need treatment for their infection. Because this infection is caused by bacteria, antibiotics can often treat it. Sometimes surgery is also necessary. The medical name for this condition is Osler's nodes. Sign number 10. Brownish or reddish discoloration, usually on your soles or palms. What might this be telling you? You have an infection in your heart or blood vessel. The spots that developed on the bottom of this patient's foot are also a sign of a heart infection called infective endocarditis. Unlike Osler nodules, these spots are painless. These spots will clear without treatment, usually in a few days or weeks. The infection requires treatment. The medical name for this condition is called Janeway lesions. Sign number 11. Non-itchy rash, flat spots with slightly raised edges, and fever. What might this be telling you? You have rheumatic fever. If your child develops strep throat, treating it quickly is important. When it's not treated quickly, other medical problems can develop. One such problem is rheumatic fever. While this seldom happens in the United States today, rheumatic fever is common in developing countries. When a child has rheumatic fever, it can lead to lifelong heart disease. Rheumatic fever is a leading cause of heart disease in children. The medical name for this condition is called erythema marginatum. Sign number 12. Rash and cracked, swollen lips that often bleed. What might this be telling you? A child has Kawasaki's disease. When a child has a rash, fever, and extremely dry lips that may crack and bleed, Kawasaki's disease is a likely cause. This disease, which affects the blood vessels, usually develops in children between the ages of 6 months and 5 years of age, while Kawasaki disease may go away on its own within 12 days without treatment. It can lead to serious side effects, such as heart disease. The medical name for this condition is mucocutaneous lymph node syndrome. If you notice any of these signs, make an appointment to see your primary doctor and try to stay calm. The sign could be harmless, but it's important to get it checked out. Heart disease is easier to treat when found early. Thank you for watching. Please like, comment, and subscribe. Watch more videos by clicking on the video here.